Okay, I want to save a bit more time right towards the end, maybe the last 15 minutes for questions about this. I want to let you know that tomorrow morning, I'm going to get into the whole area of what I consider a basic lie that formed a child's spirit at a particular time. What I mean by lie is what happened is they weren't in the safety of the we, and so they've used a self-protective strategy, and it's a lie because that strategy now is dysfunctional, and yet they use that strategy on in different areas of their life without even knowing it's dysfunctional. And so the question is, how can you get to that little 5-year-old or 7-year-old part of them? And I already gave you a hint talking about our daughter Stephanie, and at that moment when she exposed that little girl, she was actually 17 or 18 at the time her mother died, but then prior to that, the family unit had split apart. Earlier on, I suggested that there were other things that happened to their family, and so she was 17 or 18, but she was also stuck at an earlier age too, and so once that little girl voice could articulate to the pastor that this is what she believed about God, and then God could talk to her through the pastor. You could see that moment created an incredible change within her heart. And at that point then, so this is my working definition of confession, being able to articulate. The same thing yesterday, I talked in the context of marriage relationships, that past damage can get healed, but only if it's articulated. That when you feel very, very safe in the presence of another person, you can articulate some of your immature strategies, which you actually believe, but when you say them out loud in the context of a loving relationship and the other person understands, it's like you now have the freedom to begin to grow up in ways like that. And so there's so many different ways that I think the lie that the devil helps propagate keeps a person stuck at an immature or dysfunctional a place in their life, and then without knowing it, they live their lives based on that lie. And I like to call it a lie because it is not the truth, because the truth does come from God, the Spirit of truth. Another thing that is quite obvious to me is that the devil always works when things are under cover in darkness. And so somehow being able to expose them in the context of the we. It has to be in the context of a loving relationship. That's why a therapist who doesn't really care about the patients does not constitute that safe place within which anything like that can be exposed or discovered. And so it is in the context of a loving relationship or the context of the we. And sometimes that private confession before God. When you and God are a we, and that private confession to Him helps you mature. Of course, all of you have done that a lot, haven't you? Or has that gone out too, private confession before God? Going back to spiritual discipline, I was talking right before the break that the types of spiritual discipline that I normally help and teach, just in general, that I know are going to help the strengthening of that person's new self, or what I call them heart exercises, have to do with worship, trying to get them more involved in a Christian community, sometimes a small group that forms that loving we and gathers around the Word of God as a way of listening to Him and talking over. You notice the two things that are important. You listen to God as you are talking over concrete situations. You're connecting God's Word to concrete situations. You can hear His Word in abstract all you want, but as long as it's not connected to the concrete places that you live, it doesn't have that influence, the same influence as it does when you are being very honest in confession, talking through some of those things that are dear to your soul or that are troublesome to your soul. And I talked about prayer. Prayer is quite profound. Prayer is absolutely critical in my work as a therapist, as a spiritual therapist, to my own prayer life, teaching people the prayer, teaching couples to pray together. I've already talked about that. But now as I think about the types of disorders I work with, going in general to the over-control disorders, thinking specifically now of more the anxious reactive personalities, the people whose minds race, the people who have more obsessive compulsive disorder, who are maybe control freaks, or people who are anxious that they're going to get criticized. I can always tell, I call them big heads, by the way. And yesterday I told you that big heads always marry big bodies, you know. These two seem to attract each other. The two opposite strategies seem to attract each other. I can always tell a big head. All I have to do is criticize, and all of a sudden I see that big worried look. Oh my gosh, did I do something wrong? You know? I got a big head, just like that. You can figure those out real quick. Carl, this is all wrong. See, I see the big head right there. I got him. Oh my God. Sorry, Carl. Sorry, I didn't mean to do that. Oh, you probably are a big body, actually. Thinking about those types of disorders, now I realize that the person stays, the center of that person's consciousness is obviously here. In other words, they are mind controlled. So that at any given time, they'll be thinking through something, they'll be worried about something, they'll be, thinking back over this, and these people are the if-onlys and what-ifs. And I think back, oh, if only I'd done this, if only, or what if this happened, So the people who then overuse their mind and they miss most of God's goodness in life. They don't wake up just saying, wow, what a good day, and enjoy His creation, but oh my gosh, what a good... Okay, you know who you are. It occurred to me that if you've got someone like that, you've got to develop a technique that will literally get them out of their minds. In other words, make it impossible for their minds to continue to control. Because in very subtle ways, even though I'm explaining different things to them, they take it in their mind and they think about it, see? And so no matter what I tell them, their minds take over, and their minds sort of act as everything else. And so how do you get a person to move from the mind to the heart? And the answer actually comes from the old tested and tried tradition within the Christian church of meditation. Because meditation, and of course there's a lot of spin-offs from it, and certainly Eastern thought has brought enough of that type stuff in, and practices that try to center yourself and things like that. And not all of that's bad, because you can adopt some of those techniques, and I utilize a couple of the techniques within my counseling. What I mean by meditation now, and this is delineated in the workbook, Living with Purpose, some of the meditation exercises. What I mean by meditation is, it really comes from this be still and know that I am God. And so if you're going to get your mind to take a break, if you're literally going to get your mind to take a break, then, and this is growth, because the first time you try this, you'll focus in on and I love to have people meditate on just a sentence of God's Word, like be still and know my soul. It's a favorite one I have to meditate on. What happens is when you think about a word or a series of words and you put your whole focus on that and put it in your heart, your mind can't race. In other words, you can't do both at the same time. And it's almost like your mind gets bored and finally just tunes out. Because all you're doing is focusing on this word, or those series of words, be still and know that I am God, be still and know that I am God, or even focusing on a single word, Christ, or something like that. You've got the capacity, by using the techniques of meditation, of actually stopping a person's mind and giving them a chance to focus in more deeply, because as long as your mind is active, you stay on the top 2 inches of your consciousness. See? You can't get below it, because it's always, what about this? See? Like this, even pointers sometimes are highly anxious people. And so to be able to get the mind to quiet down enough to be able to be still and listen comes the techniques of meditation. I teach meditation in connection with breathing. I like the breathing technique, and I like to think of it as the ruach, the Spirit of God inspiring the person. So I'll have this imagery, and a lot of times I will talk them into it. In fact, I've made some tapes helping people relax with imagery based on God's safety and His presence. And so to be able to sit, and these are what I call semi-hypnotic tapes. In other words, as you listen to them, you breathe in and breathe out, and your mind just goes, your mind just, your mind can't stay as active. And so it's actually utilizing the process of quieting, call it the quieting response. And I find that initially, if a person tries to do it themselves, it's very difficult. Because I'm going to show you a clip of a video in chapter 4 now that summarizes some of these, or at least the meditation technique and the other technique, which I call fasting, by the way. Yes, fasting. But because if you ask a person to do it by themselves, they can't, because they sit and they take a verse and they start reading it, and the next thing they know, and then 2 minutes later, like, where's my mind, because it's very difficult for them, having been so used to use their mind as their protection and always worried and things like that, so used to that, it's very difficult for them. It's almost scary for their minds not to be in control, so their mind just jerks them out because the new self is so weak, so to speak. They're not able to. So a lot of times I will make a tape for them and actually spend maybe a 5-minute tape where they sit and listen each day, and just use that time as a time to focus on Christ and focus. And I use a breathing, have them breathe. I use some progressive muscle relaxation. That usually helps, because if muscles are more relaxed, your mind, especially the muscles around here. Because I found out that people who are highly mind controlled, their necks are always tight. Because one of the ways you keep from feeling down here is you keep your neck tight, and then somehow your mind then controls everything. And so, okay. This is called a stiff neck generation, by the way. And so to be able to move that person so that their center of consciousness, notice that center of consciousness, and I also teach what I call the 16-step walk. For that person, they're always up here, and so what does it take to walk down here? And they can actually, some especially highly spatially oriented people. And here, like NLP, neuro-linguistic processing, really helps. There are some people that are highly spatially oriented, and so if I can give them a visual picture of them walking, they can feel the deeper they get, the more relaxed they get. And so, such more spatially oriented people, that seems to work. Others are more auditorily oriented, and for people like that, then to hear words that then will lead them into relaxation, words that they are safe and comforted, that really helps. And sometimes highly visually oriented people, I have them actually visualize a safe place. Someone at the break gave me a really neat image that I haven't used before, but it's like the incarnation image. I really love that the more I think about it, because the image is of Christ being totally helpless as a child in Mary's arms, God totally vulnerable, and yet risking being in that vulnerable position to save us. And so then how about you being that vulnerable in Christ's arms? And so an image of such vulnerability where you as a child feel very, very safe would be a visual image that's very real. I mean, this is the images that Christ himself, in Nicodemus, he said, you must be born again. And so you can take various images of Scripture that bring images of Christ's presence and safety. And sometimes for the auditory person, I will have them actually listen for what Christ is saying to them. Now, let's see if there's any other. I like sort of utilizing the modality that person seems more comfortable with, and the more powerful modality to benefit when I'm trying to find out what is going to be more effective to teach that person that Christ is real and he lives within them, and that they need to spend time, or they can spend time in his presence. Because I tell you the truth, people I work with do not know how to go into Christ's presence. It's as simple as I can put it. They do not know how to put on the new self. And so, and I may be going too far out of bounds here, in trying to talk as practical as I am, but I'm really desperately trying to find a way that that person's faith is really going to connect in concrete fashion to the very mood and attitude that's going on. And when I've got a mind-controlled person who is very anxious and who's like 7 or 8 years old, scared to death, and has adopted this strategy for life, and from 7 years old to 37 has basically lived a ball of anxiety and nervousness, and has taken all sorts of anti-anxiety agents throughout their life to try to keep themselves calm, and has gotten addicted on Valium 2 or 3 times and all that stuff. Well, I'm fighting a pretty tough battle. I mean, I got a humongous mind. I see a sumo wrestler sitting there. The mind is going, yeah, you try to take me on. Yeah, you see if I'm going to give up. Because this mind and all the habits that the mind has developed is going to take over the situation. And as a result, the anxiety and everything else that's created is dysfunctional. So how can a person like that experience the peace of Christ? You just don't do it by saying it, but you connect Christ's words and his presence in the heart. And so how do you get to the heart? So I'm trying to teach people how to get to their hearts, because I said it's dead here. They don't have any feeling. And so for someone whose neck is tight, they've cut off most of their feeling, and their minds are like, and they deal everything with their minds. And they're very uptight people, and sort of pretty hard to live with anyway, because they're always shooting on everybody. You know, they should do that, should. So they're shooting on everybody, and they're shooting on themselves and all that stuff. How do you get someone like that to loosen up and to have a little joy in their eyes again, and their neck a bit more relaxed, and hey, God's created the world. It's pretty neat. Why can't that person experience some of the joy of his salvation in that fashion? Oh, yes. Thank you. Music. Yes. Oh, yes. In my tapes, I always like to add music, any tape that I make. And then, of course, in the worship, oh my gosh. Music is that is a medium, is an entree to get you away from thought. And music is a little opium to the soul. No, thank you for that. Yeah. For a lot of people, music is the one time that can shift in their mood, especially if the music is connected with God's presence and somehow associated with his presence. Thanks for that. Okay, what about depressed people? These are over-controlled people. What about people when I look in their eyes, I see that heaviness, that tiredness? I just saw it in a few of your eyes, but I think it's the time of the day rather than your depression. What about that look where the life's been hard, and you've struggled and you fought, and there's a lot of tiredness there, and of course you're probably on Prozac or some other antidepressant about now. Lots of Wellbutrin, lots of good stuff out there. Okay, again, that's part of God's gift, and so I'm not knocking the psychiatrists or any type of medication that sometimes, in fact, as I counsel, there's sometimes when medication is absolutely necessary to get a person to a point where they can actually function, and I can even work with them. And so I'm not knocking medication. But again, so much of depression is a disorder of the soul. And so I say, I sense there might be some spiritual stuff here that might be well for us to be able to address and to work with. Because one of the sources of depression, again, is an over-controlled mind. An over-controlled mind that has shut down the impulses to such a degree that the person no longer even knows what impulses that they have. I've got a nice little illustration in the book, Missing Ingredient. It's one of the cases that I remember because that person's depression lifted very, very quickly. The first thing I noticed about that person is when they came in to see me, that they were very concerned that they wouldn't put me out. They wondered if they were here too early, if I needed a break. And then at that particular time I was counseling, the office had a phone. It doesn't have a phone anymore. And the phone rang, and they said, oh, excuse me, we'll go ahead and take it. And I caulked on the phone and as quickly as I could and hung up. And, I asked, well, did that bother you? Oh, no, that's fine. I could just see that person was so so quick to defer that whatever anger impulse that person might have, it was gone. And so immediately I latched on to, I saw because when the phone rang and I picked up the phone, I saw just a flash of annoyance in that person's eyes. Just that, why is that occurring? But then quickly covered over, and so I caught what I thought would be a productive point. So I go back to that point and I said, okay, now the phone rang, and what did you feel? Oh, it was okay. I know you're busy, and she had all the mind was all explaining why that she should not feel upset and everything like this. And I looked at her and I said, no, sorry. Why don't you tell the truth? I said, when that phone rang, you were a bit angry at me for picking it up, weren't you? Oh, no. It's like that. I looked at her again. Oh, come on. I saw that flash of annoyance in your eyes. Why don't you just go back to that flash of annoyance and tell me how you felt? And she looked like she'd been caught like a deer in the headlights, just like that wide-eyed look. Oh my gosh, I could see that little scared child. Oh my gosh, is it safe to get angry? No, it isn't. All that. I could see her right back to that point where she had made the original decisions that no, it's you never get upset at anybody. You always defer to them. And so I said, tell me what you felt. And you should see. She said, yeah. Well, I guess there were just maybe just slight thing that it wasn't your fault because the phone rang. You couldn't help me. I couldn't get her to latch onto that anger. And I said, let me tell you how I'd feel. If I were sitting here and you were my therapist, and that phone rang and you picked it up, I'd be sitting here thinking, am I not important enough for you to let that phone ring and you... And I saw something in her eyes. When I articulated her anger for her, it's almost like, wow, that's what I felt, but can I say that? You got it? And so I broke her depression by teaching her how to get angry. I broke her depression by teaching her how to get angry. Now, I had to do something else. Because deep within her subconscious and her little mind, she thought God would be upset with her if she got angry. She came from a very religious mother who, whenever she would talk back or something like that, she would get the message, God doesn't like that. And somehow she had this image of God that if she would get angry, God would be very mad at her. Oh, how do you break that now? I mean, that's where it really was. She really believed, truly believed, that God would be upset at her if she would get angry. Not only her mother, and it wasn't safe, she said that, but also that somehow she was going against God. Oh, how do you get to that? Well, again, at this point, the most powerful thing that I have going for me is that I can now take that person's faith. I can have them work with an image of Christ. And I say, okay, now, I want you to go back. Now, not to when she got angry at me, but I want you to go back when you were a little girl and you couldn't get angry at your mother. Because, by that time we had caught that moment. After I articulated my anger, I asked her, what did she just think of? And she just thought of what she would like to tell her mother. I said, okay, why can't you say it to your mother? And then that flipped us back to when she was 6 or 7, and when, no, it was more than that. She was like 11, and she was starting to feel the rebelliousness, and she tried to articulate her anger to her mother, and her mother slam dunked her with Christ. I mean, really, her mother got all torn up. How can you do this? Look what God... And it put, it's like it reinforced all over the childhood things, and at the point, then she went underground. Her rebellion went underground. She could not rebel against her mother, because besides her father, I think had, can't remember if her father died or left, but somehow her mother was all alone, and she and her mother were the only people there, and her mother was living her life through her. It's a lot of enmeshing stuff and things like that. And so it's so powerful. What her mother said was so powerful, and when she used God, somehow that slam dunked her, and so she went underground. So I think we went back to about 11, and I said, what do you really want to say to your mother? And she knew, but she couldn't say it. So I said, okay, now, go back to that point. When your mother said that to you, I want you to listen to God now. Bring Christ at that point. Christ is always there. You hear him saying anything to you? Because I get this sense that if they can hear Christ speaking, and He's always does speak, He speaks through the Word. By the way, this is the caveat I have with this. I do know some other types of therapy that seem to use Christ's words and let people try to listen for the Word. I like to work more through the means of grace. In other words, listen for what Christ has said through His Word. In other words, I like to work through passages of Scripture or words. And so I said, okay, now I want you to imagine Christ being there. I want you to imagine Christ in the temple, and she liked this image. When He saw that something wasn't right, I imagined what His face was like. Okay, she got a lock on. She was a highly visual person. So I said, okay, now imagine now you facing your mother and feeling the anger. What would Christ tell you? Would He tell you that's wrong, or that to speak the truth is what you are to do? And that was wonderful breakthrough. Right at that moment, as she visualized herself as an 11-year-old, she realized that God wasn't against her. That God didn't want her to be disrespectful, but God wanted her to speak the truth. And I said, look what I just did. I said, when I told you in the role-playing that I did, when I told you, look, this is exactly how I would feel, I would say, now wait a minute. When you picked up that phone, I didn't feel as important to you. And so I'm upset about that. Do you think that was wrong for me to say that? She says, no. See, I didn't say it to put you down. I said it because I was saying the truth so that we can clear things up. And boy, did that click. And she took that passage and speaking the truth in a spirit of love. And she took that and she put it on her mirror. And that was like the turning point in her life. She said, I didn't realize that God wanted me to speak the truth. I always thought that if I got angry, it was somehow God would not like me or something like that. You see, that depression, the moment she could say, and she was a painter. My gosh, she was a painter. And all the stuff that she should have said and she didn't say, no wonder she was depressed. And of course, she had married somebody by then. And there's someone that she would married always slam dunked her by getting a little, hey, don't you do that. And she would immediately back down, see? So one of the keys I found to depression is finding that person's anger. Because there's subtle messages, subtle things that have been told to that person. And a lot of times from a Christian context, it says, whoop, don't you become angry. You better not become angry, as if anger is sinful in itself. There are other ways I work with depression, but that's the one I found most successful. I look for the person's anger and some message that anger is somehow sinful. That somehow they shouldn't be angry, or somehow if they get angry, then something bad's going to happen. Let me flip to impulse control disorders. I've dealt some with what I call eating disorders, the whole area of eating disorder. And one of my other daughter-in-laws, or our daughter-in-laws, sorry, honey. Another one of our daughter-in-laws is actually a specialist in eating disorders. She's a therapist, teaches at a nearby college or university. And so she and I talk some. And so I know a lot about eating disorders. And what I said before when I took you through this little small exercise in how you beat yourself up when you try to diet, she would reinforce completely that dieting is not healthy for you. People who diet usually end up weighing more after they diet. And of course the reason is the spiritual law. If you diet because you don't like yourself, or you hate your body, or you're beating yourself up, well then the body will rebel. And I call it na-na land too. I worked with people who go on a strict diet for 2-3 months, lose this weight, and then it's like, okay, I've done it now. No. They get in this na-na land. They really don't care. They really don't care. It's like they're in na-na land, and all of a sudden the weight comes on. And why? Because another force just took over. The force that they had beaten down now has its day. And so in the vying of the control of the mind and the body, You can see that if one wins, then the other one has to win. You've got this vying back and forth. Okay, for people who have serious impulse control disorders like gambling addictions, the raft of things. You can say anything and then put an addiction after it. Some way, quick fix of the mood, some way to get you either excited or to get the mood to shift. And food's a wonderful thing to do that, because you eat, and somehow in that process of swallowing, the endorphins get released, and you feel much more secure and happy and things like that. A lot of times it takes you back to an earlier point in childhood when you were secure when you were eating. There's all sorts of reasons that eating is a lot of times just a fix for your emotions. And of course then there's alcohol and drugs and things like that. You get into a little harder stuff and a little bit more difficult stuff to work with, because this stuff is wonderfully potent. The more potent the substance is, or the thing is, usually the harder it is to beat the addiction. Because, man, I don't know, any of you been addicted to crack cocaine? No, of course you wouldn't admit it. Any of you on it right now? No, you'd be a little bit happier if you were. Stuff like that is just so powerful, because you're only 3-4 seconds away from that wonderful feeling. And no matter what mood you're in the same way, alcohol is a little bit slower and things like that. But all this stuff has an addictive quality because it fixes the mood. In other words, it's not what God intended to make you feel better, but it's something that works fast, and so you choose to make that choice, and somehow how your soul is organized. And a lot of times the addictions come from watching someone in the past. Like if your father used alcohol, or someone in your background used alcohol as a way of fixing their emotions, well, you're more prone to do that too. Or in a real scary way, if any of your parents crossed the line sexually, then your chances of crossing a line sexually go way up, something like 5 or 6 times greater chance that you'll cross the line sexually, because that was a way that one of your parents began to fix. And you don't think your children know it, but your children always know it. If you cross the line even subtly, or trying to keep it from everybody else, somehow your children always know it. I don't know how they do it, but this is sort of that spiritual stuff that runs through families, where you sort of know what's really going on. That's as an aside. This is where a lot of this stuff comes from. Okay, the issue is how can you use faith, Christ's presence, to begin to help some of those addictions? Well, let me tell you about a person I dealt with that had sort of it wasn't a real severe eating disorder. It was like a binge and then a purge, usually 2 or 3 times a week. Very instructive as I talked with this person. This person was very open and honest. In fact, one of the ways the person described their disorder was they would get this funny feeling. It's just like they can feel their mood. And they just knew that they were going to do it, and they knew they weren't going to be able to stop themselves. They just got this funny feeling, and all of a sudden, the next thing they knew, they were driving to the grocery store, and they would grab a tub of ice cream, and they would get some brownie mix or something like that, and get some donuts or something like that. And they'd scarf down the donuts on the way home, and then they'd eat part of the ice cream and make the brownies, eat part of the brownie mix while they're doing it, and then eat all the brownies and the ice cream and something like that, And it's like this. I don't know how to describe addictive behavior, but it's more just like it's a compulsion. I mean, it's like you can't stop yourself. It's just more and more and more until finally you reach that click, whatever that click is, where it's it's like you feel different. Your mood shifted. Well, then of course there's that fear of getting fat. So then of course the person would purge then, and it wasn't. It was like 2 or 3 times a week, so it wasn't so full blown that they did it every day or something. I've worked with some anorexics, and we'll get into that tomorrow. Ooh. Where that hidden message is so hidden. I can't get to it. It's just so subtle, where that person knows logically. Like one of the students at our school that I'll talk about, just absolutely brilliant, one of the most brilliant students I've worked with, but yet she was down to like 47 pounds. And she knew she was dying, and she knew everything else, but it didn't make any difference. She had this non-land glaze, and even though she could articulate all the reasons that she should eat, and she still had this non-land glaze. How in the world do you get to that? How do you get to that, to what that spirit has done and formed this, whatever message it is she's living under? Whew, that's tough stuff. So that's tomorrow. That's a little bit too heavy for right now. But going back to addiction, this gal. That's what I said, one of the ways that I found very powerful is fasting. I taught her fasting. Now, you may think this is archaic, and I think even in a passage from the Lutheran Catechism where it says fasting and bodily preparation are indeed a fine outward training. Indeed a fine outward, I mean, he doesn't say it's bad, but he says that won't get it. I mean, those are fine outward trainings, but he was faith in these words given and shed. Talks about the heart of coming close to Christ. But this is another tried and true practice within the history of our church, is fasting. How many of you utilize that regularly? A few. Okay. Basically gone out of practice. Basically gone out of practice. You're fast. Yeah, you're fast to the table. Yeah. And slow to leave. There you go. Okay, let me separate dieting from fasting. Dieting is because you hate yourself. Fasting is because you love yourself. And just like one of the techniques I utilize when a person's mind is out of control and their obsessive thoughts, I literally have them walk to their heart, take their arms and connect them to their heart and hug their head and say, hey, I'm in charge, you don't have to worry. It's almost like they're hugging a little child. Hey, I'm in charge, you don't have to worry anymore. And I've found tremendous relief. And people, it's like their spirit their new self has taken charge. And they're saying to their old self, to the head, hey, I'm in charge now, you don't have to worry. I'm not going to let the impulses get out of control. You don't have to worry. See? And that little exercise where they literally connect their arms to their heart where Christ lives and they hug their head and they're saying to their mind, hey, I know you're trying to keep us safe, but you don't have to do it. See the love in that? It's no rebellion. You're not telling head, get out of here, I don't like you. No, you're telling your head, thanks for keeping us safe, but we don't need you anymore. I mean, you don't have to worry. Just take a break. Again, that's another concrete way of trying to get the person to feel, to sense the safety of Christ in a very concrete fashion so that their mind begins. Well, I do the same thing now with fasting. Fasting is a way of controlling the impulse in a loving fashion. The purpose of fasting is not to lose weight. And you're certainly not doing it because you hate your body. It has nothing to do with that. You're not trying to punish your body, which dieting normally is. But the purpose of fasting is really so that you can spend more time in Christ's presence and use the impulse as a way of staying in Christ's presence. The way I teach fasting, and actually this is the way I was taught as a little boy, for you see, before my first communion, one of the things that my father suggested we do was to fast. And so as a boy, 12, 13 years old, I still remember that evening, and I wish this were much more ongoing. I still remember that evening where, and this is actually where I go to find the procedure to teach my clients. But I still remember that evening when, I had lunch, but then went without evening tea or dinner, we call it. And for a boy 13, 14 years old, that's pretty traumatic. And so my instructions my father had was, I want you to spend the night in prayer, and every time you feel hungry, I want you to let that remind you of Christ's love. Well, guess how often I thought of Christ's love that night? I mean, and then of course, for some relief, then I could have a snack before I went to bed, so I could actually function. But there was I remember that period of time for 2 or 3 hours where almost moment by moment, I want to eat, and then could remember to pray. Okay, this is exactly what I teach now. I tell a person to go, and don't do it dramatic. Rather do it in this fashion where, let's say you will skip an evening meal, and then maybe even eat later on that night, but have a period of time, 2 or 3 hours, where normally you're going to feel hunger. And of course, up until that point, this person, anytime they felt hungry, they would fix themselves. I mean, as soon as they felt hungry, they would open the refrigerator and grab something, or it was their, sort of their addiction, so that they really could not stop themselves from eating. They really could not do that. So now it was, every time that they felt hungry, they were to think of Christ. That was the time to remind themselves of Christ, offer a prayer, hook their hands, connect their arms to their heart, hug their stomach and say, hey, I know you want to eat. This is our time to pray. In a very loving way, to say no. It's like you're setting boundaries on the impulse and saying, no, it's not good for us to eat because this is our time to pray. And do that for 2 or 3 hours. And you should see, I remember this one case in particular, the woman comes back. And the next morning it's like I woke up with a feeling like I've never had before. It's like finally I can control that it's not, I realized how much this force dominated and drove my life. Like I woke up and I had a totally different feeling about life. Now, I'm not saying that this is a quick fix or this works for all, and certainly when you're talking about the serious addictions like alcohol or something like that, you really need the context of a community like a 12-step program or something like that, which helps make you more accountable and form. I think one of the geniuses of the 12-step program is you form that we with another person in total honesty. I mean, my gosh, the AA has more honesty than the church has most of the time, And so it's in the context of that honesty, and you're not going to be slam dunked if you slip or something like that. You can be totally honest. That's one of the rules. In that context of a we, where it's safe to be honest, I think you need community like that and things like that, because those are very tough. I just want to tell you how then the presence of Christ in a concrete way, putting on the new self, and then saying, no, it's not good that we eat. This is not good for us, actually begins to establish some control in an area where the person really had no control. And they utilize this as a way to fix themselves. Same way with money and things like that. In addictions such as this, I found what I call just basic fasting. Fasting is one of the easiest things to teach, by the way, because everybody, if you skip a meal, is going to get hungry, and so you can use that as sort of a gauge for beginnings of controlling of impulse in a loving way. Yeah. That's right. Yes. It's not good for us because the us is now the whole soul. So you can use the word us and think of Christ too. But if you get my drift now, you've got two people inside, and when they become a we, it's safe. Notice what it said? When these two become a we, when you begin to want to do what you should do, you're a we now inside. See? That's what God intended. That's why I used the word us. Thanks for catching that. Okay, open for discussion about spiritual discipline, its utilization. Again, let me make sure you understand that I'm just talking about the spiritual dimension of counseling, like a missing ingredient, something extraordinary, certain things that you can do because you are a Christian and it has to do with your own faith and your own spirit, or as you work with people, how you can utilize their faith to actually make a difference in specific types of disorders, and begin to see that there is a spiritual dimension to disorders, because disorders have to do with the disordering of the soul or the psychikos, where certain strategies or certain ways of taking what God has created there in some sort of fashion are dysfunctional. So make sure you hear that. I'm not going through all of the other techniques that I utilize as a psychologist that work with specific disorders, the cognitive and the Gestalt and all that stuff. I'm not going there. I'm going specifically to those things I do that are spiritual in nature. So on this that caveat.
Going back to the anger one, some people that's the only emotion they can express. They're not, a lot of men, I'm sorry to say,
oh, yeah,
are not able to say what they feel. It comes out angry and...
Okay. That's exactly right. No, I'm talking only about people who are highly depressed who cannot even get in touch with their anger. Now, if you give me a male who can do nothing but get angry and hides all the other emotions, now it's something different, totally different. I'm not going to ask that person, hey, what's your anger all about? No, you're right. No. No, there are some, and I like what you said, there are some people who take every emotion, fear, anxiety, everything else, and immediately push it into anger. And these are the more what I would call impulse controlled people. In other words, just get angry at everything. That's their strategy for life. They're rebellious. They're type of rebellious, and that's dysfunctional, because then they can't get down and express the tender emotions or actually make connections, because they're always keeping themselves safe. And what I see from people like that is they keep themselves safe by constantly hiding behind their anger. And so their anger, is a facade. It's actually no. I wouldn't ask a person like that, hey, tell me what's your anger. For a person like that, let's see, let me flip into a case or two that I've worked with. What would I do with a person who, actually I found that tears, anger and tears, a lot of times are about 10 seconds apart. And so this is a quick, I was just thinking of one case where that person was reacting in anger, and I looked at them let's see, I can't remember exactly what I did, but I remember in 10 seconds that person had tears in their eyes. And I think what I did is in the anger, I caught where they'd been hurt. And I grabbed onto the hurt, and then I saw the little, I remember, I saw the little boy there. I saw the little boy there, and the self-protection like that, the big macho stuff. And I caught that little boy, and I grabbed a hold of that little boy and made it real safe. And about 10 seconds later, he was remembering his father's anger at him, and but it usually doesn't work like that, because usually the anger is so well defended that you no cracks in it. But watch out, I can spot most cracks, so.
I was just, I've worked with people who overeat because of really bad self-image. If you suggest fasting to them when they already have a mindset of failure, like everything they go into, they're going to fail. A lot of them think they're not going to succeed, and they've failed at their fasting. What's your next move after that?
Well, a person like that, I'm not sure I would suggest fasting. They seem to be more mind controlled. See, there I would suggest more image of meditation and the picturing of being cared for by Christ and things like that. See, I'm talking about someone whose impulse more, and the person you described, poor self-image and things like that, they still may have an eating disorder, but the predominant problem seems to be they're always beating themselves up and they never feel adequate. See. And so I'm glad you mentioned that, because no, there's a time I wouldn't suggest fasting, because that person already feels that they're going to be a failure, and that something like that. And also, if I do, I always make it very time limited, so that they do it for only a very short period of time, then come back and we'll talk about it, or readjust it. And always give them the caveat, hey, you may not be able to do it, and if so, let's adjust it and see if there's a way we can function. But I like what you said, that sometimes a person is so, and the person you talk about with a very poor self-esteem, normally every time I hear a person with pretty poor self-esteem, I hear a person whose mind plays tricks on them. Always is criticizing them, so I sense a really highly mind-controlled person who is always picking everything apart that they do, and a highly perfectionistic personality and things like that. So usually I work, again, with more meditation techniques with someone like that. But good, thanks for that. Other thought, here's a question over here. See, we've got about 5 more minutes.
I was also going to say that when dealing with people with depression, we also have to be aware that quite often what people call depression, if you listen to what they're saying, is actually sadness. Mm-hmm. And you have to tap into their sadness in order for them to come to that healing of the soul as well.
Good, I'm glad you say it, because the cases that flashed in my mind were more repressed anger. But there is a type of depression based on loss, a tremendous, and in fact there's a whole theory called object relations theory that focuses wonderfully in on the loss process and what that does profoundly in the sadness of the person. Yes, that's what I said. There's another basis for the anger, and if you can listen carefully, you'll see that the anger is based on the sadness, and not just on the lack of getting heard sometimes, or the oppressed. But they both sort of have the common basis of not getting heard. And so again, sometimes in listening to their anger, I can pull out the sadness of not being heard. Okay, other...
I'm just wondering how you work on the balance of somebody who might have an over-control disorder and an impulse disorder. Like, how do you work on getting the new self or the we to balance up again if they're displaying both?
What you're just describing, a lot of times, I was describing someone who either was way over-controlled or way impulse-controlled. Most of the people that I deal with are typical back-and-forthers. In other words, they will be, let's say sexually. They'll get into a relationship, act out sexually, then they'll beat themselves up for being so stupid. And then they'll go in another relationship, and then they beat themselves up. And that's sort of a sequential, either acting out and beating themselves up. So depending on which part of the cycle they're going through. Or, again, a person who's ever dieting, always dieting, and then, then messing up, and then going back and mad at themselves diet, and then they go in this cyclical thing. And by the way, it's so typical of the college age. I would guess, I checked my students, the university age rather. I checked my students, and about 80% are somehow unsatisfied with their weight, and about 60% are at any given time actively thinking about dieting. That's so sad. That's so sad. These are the females, by the way. So sad. You're asking, what do you do with something like, what sort of spiritual exercises? See, I was trying to think of about the only thing I can come up with different from what I said, because I do work with fasting or meditation depending on what I feel the strongest. What I remember one case where I worked on where they felt that they were not. I asked them, well, where are you when this pattern is occurring? Well, I find out that their spirit shifts. It's almost like after they've eaten too much, then it's like their spirit allies with their mind. And so now they're accusing themselves, see? And then it seems like they shift that whenever they've been good for, and this is usually the way they describe it, you can see how young the person's sounding. Well, they've been good now for a month, and now they deserve something. Now they deserve this, see? And now they flip over to they deserve. And then, of course, that goes too long, and now they get upset at themselves. Now they feel justified in beating themselves up. So the new thing is to identify that pattern and see what age they are. I was thinking of one person I worked with a pattern was a college age or university age student, and I found out that this was a pattern that she had developed as she started going through her puberty. And it was almost like her anxiety over the sexual development caused her to focus on this as a pattern. I can remember then going back and in the actual issue really was her sexual development then. I was trying to think of what I did. I can't think of specific what I did spiritually except her prayer and things like that. But I remember And you can see what I'm doing. I'm always trying to go back and find out what the real issue is. I guess what I did is got to the lie. The eating stuff was more a lie. It was a subterfuge, but the real issue had to do with her fears of her sexuality and so forth. And if you really want to know, this is a little scary, where that came from is her father started looking at her differently, and she started feeling some vibes from her father as she started getting more sexually developed, and it just scared her to death. And so finally we got to that lie. I finally got to that point where I found out the driving force. And so I think it was at that point it was more the surfacing of the lie. Sorry, didn't want to get quite that elaborate, but okay. I think there are no other questions. Probably are, but our time is about up. Hopefully, see most of you tomorrow when we deal with some more intriguing things about. I want to get into this lie a lot more. I want to also look at the potential for utilizing like the reconnection model for education. To do more than just see it work within counseling, but how can we begin to teach people in a more education way how to live their lives closer to God, or how can we teach them to put on the new self in many contexts other than in only the disordered soul or the disordered lives. So I'd like to close again with a prayer. Oh, good and gracious God, your Spirit, the Spirit of love and the Spirit of truth, pervades our lives and our consciousness as we open ourselves to you in confession. Help heal our disordered lives and souls, and through us bring healing to so many, so we may live our lives more with love and joy and peace and patience and kindness and goodness, faithfulness and self-control, which is the fruit of your Spirit.